Welcome to this short video, Spasticity, Adverse Effects, Aggravating Factors and How to Manage Them. Your presenter is Jackie Harris, MS Physiotherapist. The video will cover adverse effects of spasticity, aggravating factors of spasticity, and addressing and minimising those aggravating factors.
Adverse effects of spasticity. So these are the kind of things that can happen as a result of spasticity. So you can get muscle contractures. So for example, if you do have spasticity in your calf muscle, causing that clonus, or for your foot to point downwards, eventually sometimes the muscle can become tight, and then it's very difficult then to lift your toes and get your heel down on the floor. And in other areas as well. So, if you have spasticity in your hamstring muscle, sometimes they can become tight after a little while. Pain is definitely a big one that spasticity can exacerbate. Joint deformities, so if the spasticity is quite strong in one particular area, sometimes the joints can become quite stiff. Muscle fatigue, because spasticity often is quite like a constant contraction of the muscles throughout the day. Even when you're resting, sometimes the muscles are contracting, and so sometimes you can get that fatigue. Sometimes can affect your bladder and bowel function, so getting urinary tract infections or constipation, because it does affect, spasticity can affect the muscles of the bladder and bowel and things. That can cause problems there too, and also pressure injuries. And the reason for that is because if your leg positions or postures in a certain way, sometimes you can get more pressure in certain areas than others. So they're just things that can happen as a result of spasticity, but they're things that we want to try to avoid and treat and prevent happening. So now I'll move on to the management of spasticity. So I'll talk about addressing and minimising the triggering factors, talking a bit about physiotherapy assessment and treatment, and having a bit of a look at the medical management and medication for spasticity as well. So minimising the aggravating factors is a big one, because there's quite a few aggravating factors that can make your spasticity worse or bring on your spasticity. And a lot of them are treatable or reversible, so that you can kind of manage your spasticity a bit better. So if you do have any infections which cause an increase in body temperature, so urinary tract infection or the flu, basically if you've got a fever for any reason, that can kind of make your spasticity worse. So it's a good idea to, get on top of those straight away, especially in MS, because we know it can make your symptoms worse. It's good to see your doctor kind of straight away, just to make sure that, if you do have an infection, it potentially could be treatable with antibiotics or something like that. Pressure sore, so if you do develop a pressure sore and that sort of results in pain and restrictions of movement and things, that can kind of exacerbate spasticity as well. So really a good idea to do good pressure care, and it's a good idea anyway, but just trying to minimise any kind of pressure injuries as possible. Constipation, if you are constipated, it can cause you to be much more tense and again bring on spasticity. So it's a good idea to get on top of that, see your doctor, get treatment for that. Any kind of pain can worsen spasticity. So again, just finding out what the source of pain is, and how to treat that. And I will talk about that a little bit later. Stress and anxiety can make any of your MS symptoms worse, but again, particularly spasticity, because it kind of heightens all those reactions and reflexes. Fatigue, so definitely people find that when they're fatigued, so at the end of the day or at the end of a busy day or after exercising and things like that, spasticity often gets worse, and that's where people often, their clonus and things like that get worse too. Sudden movements or position changes, so when you're transferring or when you first stand up after sitting down, that can kind of trigger that spasticity. So if that is a trigger for you, it's a good idea to think about how you're doing those things and think about ways of is there a way of kind of doing more slowly and gradually, or possibly doing some stretches and things prior to doing certain movements? Muscle tightness. So if you do have some muscle tightness, that can kind of make the spasticity a bit worse. It becomes a little bit of a negative feedback where, you know, you've got tight muscles and the spasticity gets worse, and that causes the muscles to get tighter. So we really want to try to keep up with stretches and positioning and splints if needed, to minimize tight muscles. So temperature extremes and humidity, like I mentioned before, mostly with heat, but some people also report with, if they're cold, that can kind of exacerbate their spasticity as well. So it's important to try to maintain a temperature, and especially if you are exercising, to try to remain nice and cool in a cool environment. And sometimes some people might report that tight clothing can bring on their spasticity, and again, that's an individual thing. So for some people it might be a factor and other people not. So obviously it's just something that you can modify for yourself. So I'll talk a bit about relaxation. So I mentioned that stress and anxiety can kind of trigger your spasticity or make it worse. So it's a good idea to try to get familiar with some relaxation techniques such as yoga or meditation. And you know, there are really simple ones that you can do throughout the day. So yoga, it has been found that yoga and meditation can reduce stress and anxiety. It can reduce muscle and joint stiffness, because obviously with yoga you're doing lots of different positions and stretching. Can help improve your quality of sleep, which really helps, because we know that if you're tired, you know, that sort of sets that negative loop of being tired and fatigued and then making all the symptoms worse. It can help decrease the impact of fatigue because it can help you to rest better, and also it can help reduce pain as well, which is another trigger for spasticity.
Thank you for watching this short video. For more information, please contact MS Connect on free call 1800 042 138. Bye for now.